Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 62 new cases of COVID-19 in Windsor and Essex County. 19 are close contacts of confirmed cases, 7 are community acquired, and 36 are still being investigated. We have had 14,664 cases since the beginning of the pandemic. 13,801 cases are now resolved and 454 people are active at this time. 17 people are currently in the hospital and 4 people are in ICU. Our community has lost 409 people to COVID. There are currently 10 active outbreaks in Windsor and Essex County, 7 workplace outbreaks and 3 school outbreaks. Now for our vaccine update. Total of 124,594 doses have been administered to Windsor-Essex County residents. 114,968 people have received at least 1 dose. Regarding our mass vaccination sites, we are currently vaccinating people 60 years of age and older. In addition, those 50 years of age and older living in one of the identified hotspot postal code areas can be vaccinated. These are neighborhoods where your postal code begins with N8X, N8Y, N9A, N9B, N9C, N8H, and N9Y. When you attend your appointment, please bring proof of address, whether it's a driver's license, current utility bill, or another bill. There are a couple of changes you will see on our booking site today. There will be an area to book an appointment if you are a healthcare worker and eligible in the highest priority, very high priority, or high priority identified by the ministry. This information will be available when you're booking, and people must complete an attestation when booking. There will also be a separate pathway for people to book if they have a highest risk health condition outlined by the ministry. An attestation is required as well for this booking. And in addition, 1 essential caregiver of someone with a highest risk health condition may also schedule an appointment for vaccination. This can be done on our site as well, and an attestation is required as well. Please note that whether you are booking online or by phone, the available appointments are the same. The call center does not have access to appointments outside of what you see online. If you are booking online, please go to wevax.ca. Or if you need assistance, please call the call center at 226-773-2200, and someone will be able to help you book your appointment. If you do not have a health card number, please call 226-773-2200 to book your appointment as well. Now for further updates. I just wanted to provide you an update on our mobile clinics. We have made good progress vaccinating high-risk congregate settings in hotspot postal code areas, and we'll continue to move forward with these settings. Beginning next week, we will also be vaccinating adult recipients of chronic home care who cannot leave their homes. We have been working with the LHIN, and there are approximately 300 people we will be vaccinating in the coming weeks. 2 of our teams, consisting of a nurse practitioner and nurse, will be vaccinating in the homes, going home to home. In addition, we will begin our vaccination of farm workers. Area farms were hard hit by the pandemic last year and continue to experience these challenges due to their congregate living setting and work setting. In 2020, there were nearly 50 COVID outbreaks in farms and approximately 2,700 cases among workers. Erie Shores Healthcare and our public health inspectors have been working with the farms to create awareness of the vaccine, and we are now working directly with farms and booking them to attend the Nature Fresh vaccination site in Leamington. In addition, vaccination on Peely Island will begin next week, being provided by Orange, and this will also include the farm workers on the island. And finally, I want to remind residents that they may also be vaccinated at one of the participating pharmacies in Windsor-Essex County. Pharmacies are able to vaccinate those 55 years and older. Family health teams and some primary care providers also continue to offer vaccination to their patients. We will continue to work on vaccinating our residents through as many channels as possible. For general inquiries regarding vaccination or COVID-19, please call 211. I will now turn it over to Dr. Wajid Ahmed for our weekly EPI summary.
Good morning and thank you for joining us. I'll just jump right into the EPI summary. First, I'll start off with the COVID-19 cases in Windsor-Essex, and as we can see, the provincial outlook, what we are seeing right now is a third wave, which is very clear and evident, and has surpassed what we have seen in the second wave, with cases, the daily cases that has seen a high that was not seen before, with more than 4,700 cases reported yesterday. In Windsor-Essex, we have seen some increase in the case counts, but we are seeing that the increase is not the same as what as it's seen in the rest of the province. But we know that how quickly that can change. Yesterday we reported 93 cases. Today we reported 60 plus cases, and that's again a strong reminder that if we continue to follow that path, we will be in a similar situation that where we were in December and January. So it's extremely important for us to pay attention now rather than trying to come out of this third wave once the case increase at a significant rate. Just a quick comparison in terms of where we are from the province and what kind of increase that's seen in the province and in Windsor-Essex. Clearly, the upward trend in the province is outpacing the second wave, and compared to our region, we are still topping it up close to 40 to 50 cases a day now. When we're looking at the week-over-week incidence rate per 100,000 population, and it goes all the way back from the beginning of this outbreak or beginning of this pandemic to the most recent completed week, our most recent completed week case rate is 76.5 cases per 100,000 population, and it has increased again from last week where it was close to 72 cases. Looking at just the past 7 days and not focusing on the completed week, our past 7 days, our case rate is 86.6 cases per 100,000 population. And again, this has increased, and it's showing that the trend is moving in the upward direction, and we need to bring it down in our region. Looking at our wastewater surveillance data, which is indicated in the red line, and in the past week, our numbers remain unchanged from the week before. We've seen some blips, but more or less these data is still following the case rates direction and hoping that that's the accurate picture of the community, with not many cases that are not reported to us, but with the case testing and all these other requirements that we are seeing, definitely highlights the importance of people being vigilant and ensuring that they are getting tested when it's needed, and also to continue to follow the public health measures. Our person positivity, this figure looks at our person positivity, and in total so far we have completed 317,862 tests as of April 10th, and again, this is a complete week ending on Saturday. For the week ending on April 10th, our person positivity was 5.3%, and this is roughly the same where we were last week. Last week, the approximately 5,567 tests were completed. And as we can see back in the November-December timeline, our weekly testing rate was close to 11,000 and somewhere coming very close to 12,000 cases. And right now it's a little over 5,000 cases, 5,000 tests that are being done, highlighting the two aspects. One is maybe there are not enough cases and contacts that needs to go for testing, as we have seen in November and December timeline. That's why these testing numbers are low. Or on the flip side, if we think that maybe people are not going to the testing center when they should be. So I would definitely encourage anyone who have a symptom of or a symptom of COVID, or is identified as a close contact of a person, to make sure that you go for testing in a timely manner to get your test done, and make sure that we are preventing the cases right from the beginning. Mike. Okay. All right, so now comparing our person positivity in Ontario, our 7-day average, we are, our person positivity in the province is at number 7 compared to all the region in all the public health units in the province, which is, again, the overall trend is increasing everywhere else. This graph looks at the person positivity by age group, and all the age groups have seen an increase, including the 65 plus age group. This was otherwise remained low. The highest increase in the person positivity was observed in individuals between 18 to 34 years of age, which was similar to what we have seen last week. And 0 to 17, with the most of the school's age student, the person positivity is increasing in that age group as well. Just the person positivity among those in the 18 to 34 year age group was 8% in our region. This particular slide breaks down the person positivity by school-age children below the age of 18. With a special focus on the 14 to 17 years. That's the high school student in general, and then the highest person positivity, though a dip was observed this past week, but we also see a dip in other age group as well. And this increase, or this increase in person positivities coincides with the rest of the person positivity that we are seeing, and it also follows the same trend that we are seeing with respect to the case increase in the community and similar case increase we are seeing in the school-aged children. This is the epi curve for the school-aged children, and as I mentioned, the curve is following what we have seen in the community with an increase, and then some stabilizing at that level. But we have seen that in some days these cases are increasing as high as up to 90 cases a day, which is again is a strong reminder for us that things can get really bad with our case counts. Another looking at our overall 7-day comparison, school-age children versus the overall, and as I just mentioned about that, the increase was high, but then it's stabilizing with the rest of the community. Looking at our overall cumulative regional and provincial rates, our Windsor-Essex continues to have the 3rd highest provincial rate of COVID cases in Ontario. Just in the last month, starting April, our highest areas where we are seeing the case are Windsor. We have seen a large number of cases coming from Lakeshore, which is something recent, and then the rest of the municipalities are also identified in this group. Just building up on the distribution of these cases, not necessarily just the rate, but just the distribution of cases. Majority of these cases are coming from Windsor, 64%, and then the rest of the municipalities are listed. Just in the last 7 days, we've seen some increase in cases coming from Lakeshore, but the rest of the municipalities are relatively stable where they were, and including the city of Windsor, as it continues to be in the early 60% of the case distribution. Looking at our cases by age and sex, and what we continue to see is the increase in the younger population between 0 to 19 and 20 to 29 year age group, while the rest of the age bracket are either seeing a decline or the same stability in different age groups. Breaking it further down, the 0 to 29 age group, starting from April 1 to April 14, what we can see is that more than 2/3 of the cases are happening in 18 plus population, while almost 1/3 of these cases are happening between 4 to 17, which is the school age children, and then the 3% of these cases are coming from under 4 years of age. So breaking it further down, where these cases are coming from between the 0 to 29 age bracket, the majority of these cases are coming from Windsor, close to 70% of these cases. And then the rest of the cases are still coming from, following the similar trend as we have seen in the previous slide, that the majority coming from, after Windsor, it's coming from Lakeshore, Leamington, and then the rest of the municipalities are in the same age band. Again, focusing on just the 0 to 29 age group, we are seeing that the transmission is happening mostly as a result of close contact or a household contact, contributing to roughly around 2/3 of the cases, and almost 25% or a quarter of these cases are coming from a community transmission. So these individuals are contracting the disease without identifying any specific source. So recognizing that 0 to 17 are younger children, either school-age children or children at home, just focusing on the 18 to 29 age band. And what we are noticing is the community spread coming in that age group is 30%, which is, again, it's a high number of transmission that's happening through the community, something that need to be mindful of, while the household and close contact continues to be the other source of transmission. So this exposure history is in all individuals, so we're not talking about everyone in our region, and as we can see, it's a good mix of cases coming from the community as well as coming from household contact, close contact, and some even coming from travel as well. So just something that we all need to be mindful of. And if we just hone it down in terms of what's happening from March to present, a similar picture, the majority of the cases are coming as a result of household contact, but still a large number of people are acquiring the disease as a result of community transmission, 30%, which is significantly high, and we all need to be careful and mindful every time we are out there that every action of ours can put ourselves at risk of acquiring the disease, and ensuring that we must follow public health measures at all times. Among the contributing factors of these case increase is the variants of concern, and as we can see, somewhere around mid-March and to late March, we have started to see a surge in the variants of concern cases, and that surge is continued. And please note that the last few days we are subject to change, because we do receive the results sometimes late, and that number is then added. But as we can see, almost 1/3 of our cases are coming from sorry, not 1/3, my apologies. The up to 35 cases in some days are coming from the community spread, but if we look at the overall percentages, we are consistently between, I want to say, close to 40% of the cases are coming from the variant of concern, and in some days it goes high up to 70%. And this is the trend which can be much more concerning, because we know the variant of concern spread much quickly and it's much more transmissible. Similar picture in terms of the acquisition source, majority coming from household contacts, because we know in the indoor environment, these variants tend to spread very quickly, followed by the community's acquired cases, which is still again at 30% or close to 30%. A significant proportion of these variants of concerns are coming from the community, and all high-risk activities, any type of exposure can lead to transmission, so critically important to follow the public health measures. Looking at our COVID-19 hospitalization, we are across the province, there's a huge surge in the hospitalization linked with COVID. In our region, we have been lucky so far, but we know hospitalization and death are a lagging indicator. So whatever increase we are seeing right now, we may see some impact in the coming weeks. So something that we need to be mindful, as the entire province is struggling with the hospitalization and bed capacity, ICU bed capacity, and it can get worse very quickly in our region. Similar picture in the ICU. ICU cases increasing in the province, while our region is fairly stable. Another slide just to show the date of deaths in any given day, and as we can see that in December, January, we have lost many lives as a result of COVID, and all these cases, it results in people getting hospitalized, people dying, and we as a community should not be in that position to put anyone at that risk of dying, and do our part in following the public health measures to keep everyone safe. Just a breakdown of people who died as a result of COVID. Majority continues to be the age is the most important predictor of people dying, and majority of the death happening in 60+ population. Our case fatality rate compared to the rest of the province is slightly higher than the provincial average, and the most driving factor is the people dying in our community, which is higher than the provincial average, driving our overall case fatality rate in the region. Our case doubling time was high for compared to the Canada doubling time and the Ontario doubling time, but we are starting to see a dip in that trend, and that could be an indicator that we will be getting to a similar situation what the Ontario and the Canada is seeing right now. Our median R effective at this time, the most recent one, is estimated at 1.17, and this is increased from last week. And as we talked many times, when the R naught is greater than 1, each existing infection causes more than one new infection, and indicating that the trend is ongoing. So now a quick update on the vaccine status slide, and so this is the slide showing the number of daily vaccine doses administered daily to Windsor-Essex residents. And as we can see, we've been well over 2,000 doses a day, and generally touching close to 2,800 daily doses consistently, with some days we have touched all the way up to 4,000 doses. Overall picture with how many individuals received their first and the second dose, and breaking it down by age. Overall, our coverage in Windsor-Essex is 25.6%, and if we are just focusing on the 60+ coverage, our coverage is close to 75%, which is really good given the uptake in each of these category, and we hope to see that number increasing even more in the coming weeks. Our coverage in the hotspot areas within Windsor-Essex, where at least one dose was administered, and as we can see, there are hotspots area which has a higher overall coverage rate compared to the region, and there are some areas that requires more attention in terms of getting the uptake, and we are working with our health system partners and our community partners to increase access to vaccine in these areas. Quick look on where the vaccines are administered to Windsor-Essex resident, and we can see the hospital-based clinic that started was in December, continues to provide the most of the vaccine, followed by the pharmacy channel, and then the mass immunization clinic. Quick look on the vaccine that's distributed. The majority of the vaccine that is used in our region is Pfizer, followed by AstraZeneca, and we got most of these AstraZeneca as a result of the pilot pharmacy project that was implemented in Windsor-Essex. And then we have some proportion of Moderna that we use in specific situations. Just as a cumulative number of doses administered by the different type of vaccine, and as I just talked about, that majority of the vaccines that we've used in the region is Pfizer. Another way to look at it, the breakdown of how each of these vaccines picked up, and we can see with the introduction of AstraZeneca in the region, we have seen a huge uptake in AstraZeneca vaccine distributed by the pharmacy. So in summary, the case rate in Windsor-Essex is higher for the most completed week. Our acquisition source is distributed between close contacts and community transmission, and 30% of community transmission is a significant number that our community needs to be mindful of, and every time we are going out, we should always think about that and should always take precautions. The hospitalization and ICU is stable in our region, but as we are seeing some increase in our cases, that number can easily change, and we know that this is a lagging indicator, so we just all need to be mindful of that. Vaccine rollout continues to happen in the region with largely being picked up since the beginning of March, and our overall vaccination coverage rate is 25.6% for our region. So in some the monitoring indicators for our region, most recent completed weekly case rate is 76.5 cases per 100,000 population, and just in the most recent 7-day, 86.6 cases, which is again showing a trend that we are heading in the wrong direction. Our person positivity so far is 5.3% for the full week, but the most recent 7 days is 6%. Our effective is 1.17, the most recent estimate. Thank you.
We will now take questions from the media. Today we will start with Windsor Star.
Good morning, Doctor. Good morning, Teresa. Something that stood out to me was that nearly 1/3 of our cases of late have been ages 4 to 17. Can you comment on that and your reaction to that figure?
Well, say that again, Taylor, please.
Sorry, I'll try that again. Something that stood out to me was that nearly 1/3 of our cases are ages 4 to 17. Can you comment on that figure and your reaction to seeing it?
So that figure is particularly with the age band from 0 to 29. It's not the overall picture of the community. And slide number 18, which I presented the age and sex distribution. So it shows the age range is 0 to 19 is 18% of our in the last 2 weeks, and 27% between 20 to 29. So what we did, or what I asked my epi to do, is maybe take a deeper dive in terms of 0 to 29 and where these cases are coming from, which specific age group is impacted by it. And that's the breakdown just between the 0 to 29. But even within that age group, 4 to 17, like 1/3 of the cases are coming from the school system, which is something that that was a concern. And we know with the majority of these cases are acquired in the school-age children specifically is through the household contact, but there are some community transmission that's being reported.
I didn't look at the graph fully, then that clears it up. Thank you. And then separately about the vaccine rollout, can you explain how you plan to tackle the migrant farm worker population, considering there is such a large population and we do have such a limited supply of vaccines?
So we are working with the farms to identify temporary foreign workers and also local people that are working on the farms directly, so people living in congregate settings and those working in the farm setting that are in specific areas, like in the operations part of it, and working side by side and doing the work of, they have different names, but we have very specific roles within the farm. And you're correct, we have limited vaccine. We are using Moderna for the rollout and hope to do approximately 400 people in a day. And we will just continue to work our way through the farms and do the best we can. And we are, based on the number of workers, temporary foreign workers and local workers that are working in those high-risk settings, it'll vary, but we will just continue to try to make progress. And for next week, we have all of our, we have farms booked all into next week. We're working on the following week. And the farms have a big responsibility in obtaining consent and giving that preliminary information. We'll get consent as well at the vaccination site, but they're doing all of that background work as well to make sure people have all of their questions answered and, provide an opportunity for the vaccinations. So we'll do our best to do as many as we can.
And looking at the Windsor-Essex County residents vaccinated with at least one dose by age group, the lowest number above 60 is age 60 to 64 with 65.8%, and then all of the older age groups have even higher coverage than that. Can you comment on our coverage rates among the people who do have access to the mass immunization clinics right now?
Yeah, so overall, our coverage rate is pretty good. We definitely like to see a higher coverage and in each of these age group, because we know that most of these individuals in the older adults are mostly impacted by the impacts of COVID. And just in the 60 plus coverage, our coverage is, as an overall, is 74.6%, 75%. Okay, we can say it, which is pretty high. But again, it's we'd like to vaccinate as many people as possible. So anyone who isn't vaccinated yet in the 60 plus category, they should take this opportunity to get the vaccine. They can go online and book their appointment, and we want we want a very high coverage rate of 90% if possible, just to make sure that we're doing our best to protect our most vulnerable and to keep the transmission down in our community.
If residents age 60 and older decide to for some reason wait a while to get the vaccine, and it opens up to more age groups, more essential worker groups, might it make it more difficult for them to make an appointment quickly?
Yeah, if we have more priorities, then we only have limited number of vaccines, so it just makes it difficult. So you are basically competing for the same spot, but the competition now has increased with many different priorities. So as you know that you are the priority, anyone who's in the 60 plus, that's your opportunity. You will have a much better opportunity to get your vaccine before it opens up. When more and more priorities open up, the competition gets more bigger, and the challenges to book an appointment will be much higher. So I definitely want to encourage people, if they're still contemplating whether they should get the vaccine or not, I think you should get the vaccine immediately, whatever vaccine that you have access to. That's the only way we can try to keep this number down, on top of the public health measure that we are all following.
Thank you.
Are there any questions from AM 800?
Teresa, I'm not sure if I missed it, but how many active variant cases are there right now?
I believe there are 129. 121, although I said 129 yesterday.
Yeah. Okay.
So 121.
Sorry, 120.
121.
Perfect, thank you. Dr. Ahmed, going back to the presentation, I know we talked about this last week, and you mentioned it in Taylor's questions in regards to the age groups. The one for the breakdown, 18 to 29, from April 1st to April 14th, the different percentages there. The one that stands out to me, community, 29.8%. So these individuals, is it safe to say they're not sure how they're getting the virus, it's just out in the community?
That is correct, and that's why it is a concern that when people are out there, and we continue to remind this message that most of the time people think that they are following everything and all the precautions, but if they're contracting the disease, that means there's some lapse of public health measures. That's what led to the transmission. So when you're going out, by default, you should assume that if people who don't live with you could be infectious and could be spreading the disease. If you're touching any surface, if you're going into any stores, any places, there could be a possible potential that someone could be sick there, or the surfaces could be contaminated. Hand washing more frequently, ensuring that you're wearing your mask, you're maintaining your physical distancing. Those are all the critical things that we should always do in this type of situation when you have almost 1/3 of the cases coming from the community. So please be mindful every time that you're interacting with anyone who doesn't live with you. There could be a strong potential that they could be infected or without knowing their status, and you could contract the disease. So it is a concern, and everyone should be mindful of that.
For that age category and that percentage of 29.8 in community, is that one of the highest we've seen since the beginning of the pandemic for that age category, not knowing how they're contracting the virus?
I cannot say with certainty, Rob. I think I never broke it down by this particular age category just to see where they are acquiring it. This is of particular interest because we are seeing an increase in that age band between 0 to 29. So that's why I asked for additional analysis. I don't recall that we have done similar analysis in the past just by breaking down age by age, but we'll always do if the data is different than what we are used to see, then we'll do further analysis. But I can't say that in the past whether it was high or low, but for now it is 30%.
Thank you.
Any questions from CTV?
Already asked and answered. Thank you.
Okay. Any questions from CBC?
Yes, hi, good morning. I crunched the numbers and based on what's on the Health Unit's website, around 7,700 fewer people received first doses so far this month compared with the last 2 weeks of March. I know that every health unit is sort of at the mercy of forces outside their control right now, but what is your reaction to that? Is it frustrating given the work that's been done behind the scenes to make our vaccination effort happen?
Well, it does take a lot of work to get the vaccines out, and we recognize that we're not immune to the shortage of vaccine that's been seen across the province and across the country. We could definitely use more vaccine. We definitely want to vaccinate more and more people as quickly as possible, but we recognize that this is not an issue, isolated issue with Windsor. This is a provincial issue. This is a federal issue. And we hope that in the coming weeks and months, we'll be in a better position to have more vaccine and dispense more vaccines as quickly as possible.
Thank you. We heard about a shop owner who is apparently not letting people into his store if they've had the vaccine. Are we seeing a lot of, conspiracy theory activity in our community? And is that a concern?
Not to my attention. Our communication team generally keep track of some of this information, but I haven't come across with that story or that information. With our vaccine rate, what we are seeing, especially in the senior age group, I think our coverage rate is pretty good, and we definitely want everyone, if they have question about vaccine, please go to the credible resources. Come to our Health Unit website, go to the National Advisory Committee on Immunization website, get to some credible, authentic website rather than getting your information from Facebook or from some other sources that are not credible. If you have a primary care provider, your best source of information, trusted source of information is through your doctor. Talk to your doctor if you have any questions. All these vaccines are safe and effective in preventing the complications related with COVID. We have seen, since the high rate of vaccination in our long-term care home and retirement home, knock on wood, they are much better placed now, and truly as an impact of the high rates of vaccination in that group. So get your question answered by a credible website, professionals who know what they're talking about, instead of getting your information from so many other sources.
Are there any questions from Blackburn?
Yes, good morning. I'm not sure if you could answer this one, but I know that we estimate that there's about 8,000 to 10,000 temporary foreign workers who come into the community every year. And our vaccine allotment was calculated on a per capita basis. Do you know if they were included in our population count when they were calculating our vaccine allotment?
Yeah, I don't know the answer. I think what they go with the overall population and these temporary residents in the region, I don't know if they are factored into the population or not. We have a significant portion of many international students as well. So I think the census data, that's the data that they use for some of these calculations. So I can't say for sure, but the province and the federal government, they are both aware of the temporary foreign worker situation in Windsor-Essex, and we continue to advocate to make sure that we get the vaccines for to address all the issues in our community. We know our temporary foreign workers have seen a huge number of cases last year, large outbreaks with a significant impact in our healthcare system in our region. And it is a priority for our community, and the province is aware, the federal government is aware, and we continue to advocate for vaccines to incorporate or take into consideration for all the different priorities that we have in our community.
And I know your staff are busy, so I'm not saying it's something that needs to be done, but has there been any attempt made to see how many of our residents have been vaccinated in the U.S. through their job and how that could affect the overall vaccine coverage rate?
So I think our vaccine coverage rate will definitely increase if we take that into consideration. And it's not necessarily our staff job to collect that information, because we know that there's a provincial registry that all this information and data needs to go into the provincial database, which eventually go into a national database. So there has to be a mechanism that's not a local mechanism. There has to be either a provincial or a federal mechanism to get that information. We flagged this for our provincial government, and they flagged it for our federal government to have some kind of a data sharing agreement or some sort that we can at least get information for our resident or in some way that they can either self-report or that information is captured. So it's not necessarily our issue, but we are aware of that, and we have flagged it for the appropriate level of government. And if we take that into consideration, our vaccination rate could be higher than what we are reporting right now.
Thank you.
Any additional questions from the Windsor Star?
Yes, we know that we're receiving roughly 10,500 doses of the Pfizer vaccine every week. I know you've been over this, but just to be clear, is the Moderna shipment coming every week, or is it every other week, or is it still inconsistent?
So the Moderna, it is supposed to come basically every month. We did have 2 dates in, this is April, no, in April. Both of those dates that we were given were the Moderna shipment was pushed back about a week. And so we did get a shipment this week, and we are awaiting another shipment that was due to come, because we're off schedule now. And I think it's the end of the month or beginning of May, we will receive another shipment of Moderna. And so when the shipments come, overall, and they've had, there have been challenges, and I think I shared that before, that even our allocation, it was split among 2 different shipments. At one point, we got 1/3 and then 2/3. And but overall, we're probably seeing about 2,000 doses of Moderna a week. And so add that on to the Pfizer, and I would say we're getting between 2,000 and 3,000 extra doses with Moderna based on the allocation. So we're looking at 13 to maybe 14,000 doses per week I would say 14,000 would be the top end of what we can distribute in our community, and that does not include anything that the pharmacies are doing through AstraZeneca. But with Moderna and Pfizer, if we average it all out, we could reach 14,000 a week if there's access to the vaccine in our allocation.
And I recognize that you only recently heard that the pharmacies had received, some of them had received an additional shipment of AstraZeneca. Do you know how many doses of AstraZeneca the health unit has received to distribute to primary care providers?
I have it opened here. I don't have that actual breakdown because we're also giving our primary care providers Moderna. So I'd have to look at that because I don't immediately have that right here. I think it looks like it might be 1,100 doses, but not sure.
And the AstraZeneca shipments, are those supposed to be regular as well, or are they like one-off shipments and then you hear later on when you might receive another?
So the ministry is providing the AstraZeneca, so we're not we're not getting it for the pharmacies. So that AstraZeneca is coming directly from the ministry, and the allocations are coming to us for the primary care providers. But we are using some of our Moderna for the primary care providers, so it's not an easy number to figure out. But so I don't know about the AstraZeneca actually, because that's just a recent change.
Okay, thank you.
Any additional questions from AM 800?
No, thank you. Have a good weekend.
CTV,
No, thank you.
CBC,
No, thanks.
and Blackburn?
No, thank you. Have a good weekend.
Thanks, everyone.